When most people notice that their legs feel unusually heavy, their first thought is often, something must be wrong with my heart. After all, the heart is responsible for pumping blood throughout the body. It seems like the obvious explanation. But after more than 35 years of caring for adults over 60, I've learned that the story is often much more complicated. Some of the patients who worried the most about their hearts actually had hearts that were functioning remarkably well. Their echocardiograms looked reassuring, their stress tests were normal, their heart rhythm was stable. Yet every afternoon, they described the same frustrating sensation. My legs feel like they're filled with sand. It's almost as if someone attached weights to my ankles. I wake up feeling fine, but by evening I can barely make it across the room. Those descriptions caught my attention because they pointed towards something many people, including some healthcare professionals, don't immediately think about. Your legs are the farthest part of your body from your heart, and keeping blood moving efficiently from your feet all the way back to your chest requires an incredible amount of teamwork. Your heart certainly plays an important role, but it's only one member of that team. As we age, several quiet changes begin taking place in our muscles, veins, nerves, joints, and blood vessels. Individually, they may seem insignificant. Together, they can create that heavy, tired feeling many older adults simply accept as getting old. The problem is that they shouldn't always be ignored. Heavy legs can sometimes be a harmless consequence of a long day, but in other situations, they may be your body's way of telling you that circulation, muscle function, or even your nervous system deserves closer attention. The encouraging news is that many of these causes can be improved once they're recognized. Stay with me because later I'll explain why perfectly healthy hearts can still leave people feeling as though they're walking through wet concrete. Why this sensation becomes far more common after 60, and the simple daily habits that cardiologists often recommend to help keep blood moving the way your body was designed. I'm a doctor, and for more than 3 decades, I've had the privilege of caring for older adults with heart disease, circulation problems, diabetes, arthritis, kidney disease, and many of the other conditions that become more common later in life. One of the most rewarding parts of my work has always been helping patients understand their bodies. Medical information can be overwhelming. Research papers are written for physicians, filled with technical language that doesn't always translate into practical advice. My goal is different. I want to explain complex medical concepts in everyday language so you can better understand what's happening inside your body and have informed conversations with your own healthcare provider. One of the biggest misconceptions I hear is this: if my heart is okay, my circulation must be okay. That sounds logical, but your circulatory system is much more sophisticated than most people realize. Your heart is the engine, but even the strongest engine depends on healthy roads, working brakes, good tires, and proper steering. If one part of the system begins struggling, the ride changes, even if the engine itself remains perfectly healthy. Before we go any further, I'd love to know where you're watching from today. Tell me your city and state in the comments. I always enjoy seeing viewers from across the country, and it's a wonderful reminder that healthy aging matters in every community. Now let me tell you about someone I'll call Mary. Mary was 69 years old and lived in Western Pennsylvania. She had spent nearly 40 years as an elementary school teacher. Retirement had given her more time with her grandchildren, more afternoons gardening, and finally, the chance to enjoy long walks with her husband. But over the previous year, something had changed. She noticed that after grocery shopping, her legs felt unusually tired. Walking from the parking lot seemed harder than it used to. By late afternoon, climbing the stairs inside her home felt like far more work than it should. She wasn't experiencing chest pain. She wasn't short of breath. She didn't feel dizzy. Her complaint seemed almost too ordinary. My legs just feel heavy. She assumed she was simply getting older. Friends told her the same thing. That's normal after 60. For months, she ignored it. Eventually, her daughter encouraged her to schedule an appointment. When Mary came to see me, the first thing she wanted to know was whether her heart was failing. It's a reasonable concern. Many people associate tired legs with poor heart function because heart failure can sometimes cause swelling and fatigue. So we carefully evaluated her cardiovascular health. Her heart rhythm looked normal. Her blood pressure was well controlled. Her cardiac imaging showed reassuring results. There was no evidence that her heart was struggling to pump blood effectively. Mary was relieved. But she was also confused. If my heart is okay, she asked, why do my legs feel like this? That question opened the door to a much broader conversation. Because circulation is far more than simply the heart pumping blood outward. Every heartbeat sends oxygen-rich blood into arteries that branch into smaller and smaller vessels until they reach tiny capillaries throughout your muscles, skin, and organs. Then comes the difficult part. The blood has to return. Unlike arteries, which receive a powerful push from the heart, veins rely on several additional helpers. One of the most important helpers is something most people never think about: your calf muscles. Cardiologists sometimes refer to the calf muscles as a second heart, not because they actually pump blood like the heart does, but because every step you take gently squeezes the veins inside your legs. Those veins contain tiny one-way valves. Imagine a long staircase with doors on every landing. Each door opens only upward. As your calf muscles contract, blood is pushed toward the next valve. The valve closes behind it, preventing blood from sliding backward under gravity. With every step, blood gradually climbs back toward the heart. It's an elegant system, one that's been serving human beings for thousands of years. But here's what changes after 60. Muscle mass naturally begins to decline unless we actively work to preserve it. This age-related process, known medically as sarcopenia, affects nearly everyone to some degree. The calf muscles become slightly weaker, daily movement often decreases after retirement, many people spend longer periods sitting. The tiny valves inside the veins may gradually become less efficient. Blood vessels themselves lose some of their youthful elasticity. None of these changes happen overnight. They're so gradual that most people never notice them. Until one day, standing in the kitchen while preparing dinner suddenly feels more exhausting than it used to. Walking through a large grocery store becomes surprisingly tiring. A vacation that once felt relaxing now leaves your legs aching by afternoon. Most people assume their muscles simply became weaker. Sometimes that's true, but sometimes the issue involves the entire circulation system working just a little less efficiently than it once did. Research supported by organizations such as the American Heart Association and the National Institutes of Health has consistently shown that aging affects multiple parts of the cardiovascular system, not only the heart itself, but also blood vessels, skeletal muscles, and the body's ability to regulate blood flow during activity. That distinction is incredibly important because improving circulation isn't always about making the heart stronger. Sometimes it's about helping the rest of the system do its job more effectively. Most people don't realize that many of the earliest signs of circulation changes don't appear during exercise. They appear afterward. Perhaps your legs recover more slowly. Perhaps standing still feels harder than walking. Perhaps your shoes feel tighter by evening than they did that morning. These small clues deserve attention, especially if they're new or gradually becoming more noticeable. Another reason heavy legs often surprise people is that pain isn't always present. We've been taught that serious medical problems usually hurt, but circulation doesn't always announce itself with sharp pain. Instead, it whispers. It creates subtle fatigue, a feeling of fullness, mild swelling around the ankles, restlessness after sitting for long periods, a sensation that your legs simply don't have the energy they once did. These symptoms are easy to dismiss because they're common, but common doesn't necessarily mean normal. It means they're worth understanding. And here's where our discussion becomes even more interesting. One of the biggest surprises for many of my patients is learning that healthy circulation isn't simply about how much blood your heart pumps. it's also about how efficiently your body returns that blood back to the heart. Think about a city's transportation system. Imagine thousands of delivery trucks leaving a warehouse every morning. If all the roads leading away from the warehouse are clear, deliveries go smoothly. But now imagine the return routes slowly becoming congested. The trucks aren't broken, the warehouse isn't failing, traffic is simply moving less efficiently. Something very similar can happen inside the body. Your heart may be doing an excellent job sending blood to your legs, but if the return trip becomes less efficient, your legs are often the first place you'll notice it. Gravity is working against you every moment you're standing or sitting. Every drop of blood in your legs has to travel upward toward your chest. That isn't an easy task, especially after age 60, when several natural changes begin affecting circulation. One of those changes involves the walls of your veins. When we're younger, veins are remarkably flexible. They expand and contract efficiently as blood moves through them. Over the years, however, those vein walls gradually lose some of their elasticity. At the same time, the tiny valves inside the veins, which act like one-way gates, may not seal quite as tightly as they once did. Think of those valves as small doors designed to prevent blood from slipping backward. If those doors don't close as effectively, a small amount of blood may remain lower in the legs before eventually making its way back to the heart. Most people never feel this happening directly. Instead, they notice the consequences. Their legs feel tired much sooner. Standing in one place becomes uncomfortable. By evening, socks leave deeper marks around the ankles than they used to. Shoes may fit perfectly in the morning, but feel noticeably tighter before bedtime. These are subtle clues that deserve attention, particularly if they're becoming more frequent. Now, I want to emphasize something important. These symptoms do not automatically mean you have serious vascular disease. Many different conditions can contribute to heavy legs, including arthritis, nerve disorders, medication side effects, obesity, chronic kidney disease, or simply becoming less physically active over time. That's why it's so important not to diagnose yourself based on a single symptom. Instead, think of heavy legs as a conversation starter with your healthcare provider. The next point surprised even many physicians as more research became available over the last decade. Movement throughout the day appears to matter almost as much as dedicated exercise. Many people proudly tell me they walk 30 minutes every morning. That's excellent. But then I'll ask what they do for the remaining 15 or 16 waking hours. Often the answer is surprisingly similar. I sit, I watch television, I read, I work on puzzles, I spend time on the computer. None of those activities are unhealthy by themselves. The concern is uninterrupted sitting. Research from the American Heart Association, Harvard Medical School, and other major institutions has increasingly focused on prolonged sedentary behavior as its own health concern. Even individuals who meet recommended exercise goals may experience some of the effects of sitting for many consecutive hours without movement. Your muscles aren't designed to remain inactive for extended periods. Every time your calf muscles contract, they gently squeeze nearby veins, helping move blood upward. When those muscles stay still for hours, that natural pumping action slows considerably. Imagine turning off one of the pumps in a large fountain. Water still moves, but not with the same efficiency. Your circulation behaves in much the same way. This becomes even more important after retirement. Many people naturally become less active without realizing it. They're no longer walking across parking lots at work. They're no longer climbing office stairs. They're no longer getting up every hour for meetings or errands. Instead, the body gradually adapts to longer periods of inactivity. That adaptation often happens so slowly that people mistake it for normal aging. Sometimes they tell me, "Doctor, I guess I'm just slowing down." My response is often, "Maybe, but let's find out why." Because while aging certainly changes the body, many contributors to heavy legs are surprisingly modifiable. Another factor many people overlook is muscle health. Most adults think about muscles only in terms of strength. Can I lift this? Can I climb stairs? Can I carry groceries? But muscles do much more than create movement. They help regulate blood sugar. They improve balance. They stabilize joints. They support posture. They even play a major role in circulation. After age 60, adults naturally lose muscle mass unless they actively maintain it through regular activity and adequate protein intake. This process doesn't happen because people become lazy. It's part of normal biology. Hormonal changes, reduced physical activity, changes in protein metabolism, all contribute to gradual muscle loss. According to research supported by the National Institutes of Health and published in medical literature focused on aging, preserving muscle health has become one of the most important goals for maintaining independence later in life. Strong muscles don't simply help you move better, they help your circulation work better. That's one reason resistance exercises, even light ones approved by your healthcare provider, can be so valuable for older adults. Now let's talk about another contributor that often goes unnoticed: the nervous system. Your brain, spinal cord, and peripheral nerves constantly communicate with your muscles and blood vessels. They help regulate blood flow. They control muscle contractions. They help maintain balance. Conditions like diabetes, vitamin deficiencies, certain medications, or age-related nerve changes can gradually affect these signals. When communication becomes less efficient, people sometimes describe sensations that are difficult to explain. My legs don't exactly hurt. They just feel tired. They feel heavy. They don't want to cooperate. Those descriptions often provide valuable clues during a medical evaluation. Most people assume circulation and nerves are completely separate systems. In reality, they work together continuously. One supports the other. This is why physicians often ask detailed questions that may seem unrelated. Do you notice numbness, burning, cold feet, difficulty maintaining balance, symptoms worse at night? Each answer helps narrow the possibilities. If you're finding this discussion helpful, let me know in the comments. I always appreciate hearing which topics you'd like me to explain in future videos, because many viewers are asking the same questions but haven't had the opportunity to discuss them during a medical appointment. Now I'd like to introduce another patient. We'll call him John. John was 74 and had spent most of his career working as an electrician in Arizona. He had always been active. Even after retirement, he enjoyed woodworking and fixing things around the house. But over the previous 2 years, he noticed something strange. His projects took longer, not because his hands had become weaker, because his legs tired much faster than they used to. Standing at his workbench for 20 minutes left him searching for a chair. Walking through a home improvement store suddenly felt exhausting. He assumed his heart was wearing out. Instead, his cardiac evaluation was reassuring. What we eventually discovered was that several smaller factors had quietly combined. He had become much less active after retiring. He'd lost a noticeable amount of muscle mass without realizing it. His calf muscles weren't providing the same efficient support for circulation they once had. He also had mild venous insufficiency, a common condition in older adults where the veins have more difficulty returning blood toward the heart. No single issue explained everything. Together, they explained almost all of it. That's an important lesson. Medicine is rarely about finding one dramatic cause. More often, it's about understanding how several manageable factors interact over time. As we reach the final part of our discussion, I'd like to leave you with something that may be more valuable than any single medical fact. Over the years, I've learned that the people who remain active well into their 70s and 80s aren't necessarily the ones with perfect health. They're the ones who consistently take care of the health they have. They don't wait until symptoms become severe. They pay attention to the small changes their bodies are trying to communicate. Heavy legs may seem like a minor inconvenience, but they can sometimes be your body's way of asking for more movement, better circulation, stronger muscles, or a closer medical evaluation. The encouraging news is that there are practical steps many people can begin today. Let me share the approach I often discuss with my patients. Step 1 is to stop thinking only about exercise and start thinking about movement throughout the entire day. This may be the single biggest mindset change that helps older adults. Many people believe they're either active or inactive. In reality, movement exists on a spectrum. If you take a 30-minute walk every morning but spend the next 10 hours sitting, your body still experiences long periods without muscle activity. Instead, try building movement into your daily routine. Stand up every 30 to 60 minutes if you've been sitting. Walk through your home while talking on the phone. Stretch while waiting for your coffee to brew. If you enjoy television, stand and walk around during commercial breaks, or pause your streaming program every so often to move for a few minutes. These small interruptions may not seem important, but over the course of a day, they encourage your calf muscles to do what they were designed to do: help move blood back toward your heart. Step 2 is to strengthen the muscles that support circulation. Many older adults hear the phrase strength training and imagine lifting heavy weights in a gym. That's not what I'm talking about. For many people over 60, especially those with arthritis or chronic medical conditions, simple resistance exercises performed safely can be very effective. Chair stands, heel raises while holding on to a sturdy countertop, gentle resistance bands, wall push-ups, light leg exercises recommended by a physical therapist. These activities help preserve muscle mass, improve balance, and support the natural pumping action that assists circulation. Before beginning any new exercise program, especially if you have heart disease, significant arthritis, or other medical conditions, speak with your healthcare provider about what's appropriate for you. Step 3 is to pay attention to your weight, not because of appearance, but because of circulation. Even modest weight loss, when appropriate, can reduce stress on the joints, improve mobility, and lessen the workload placed on the veins in your legs. This isn't about chasing a perfect number on the scale. It's about giving your body the best opportunity to function efficiently. Small, sustainable changes usually produce far better long-term results than extreme diets that are impossible to maintain. Step 4 is one many people overlook completely. Wear footwear that supports healthy movement. Shoes that are too tight, worn out, or lacking proper support can change the way you walk. Over time, those small changes in walking mechanics may contribute to muscle fatigue and discomfort. If balance has become a concern, discuss appropriate footwear with your healthcare provider or a podiatrist. Sometimes a simple adjustment makes walking feel noticeably easier. Step 5 involves one of the most powerful tools in medicine: observation. Start paying attention to patterns. When do your legs feel heavy? Only in the evening? After standing? After sitting? Does walking improve the feeling? Does elevating your legs help? Is one leg affected more than the other? Keeping a simple notebook for a week or two can provide valuable information for your healthcare provider. Patterns often reveal clues that isolated symptoms cannot. Now let's talk about situations where you shouldn't simply assume heavy legs are part of aging. If one leg suddenly becomes much more swollen than the other, if you experience significant pain, redness, or warmth, if heavy legs are accompanied by chest pain or sudden shortness of breath, if you notice sores that won't heal on your feet or lower legs, or if walking consistently produces cramping pain that improves only with rest, those symptoms deserve prompt medical attention. They don't necessarily mean something serious is happening, but they should never be ignored. Early evaluation often leads to better outcomes. Another important conversation to have with your healthcare provider involves your medications. Some medications can contribute to swelling or feelings of heaviness in the legs. Certain blood pressure medications, for example, may cause ankle swelling in some individuals. That doesn't mean the medication is wrong for you. It simply means your provider may be able to adjust the dose, recommend an alternative, or explain why the benefits outweigh that particular side effect. Never stop taking a prescribed medication without medical guidance. Instead, ask questions. One of my favorite questions patients ask is a very simple one. Doctor, could any of my medications be contributing to what I'm feeling? It's an excellent question because it opens an important conversation. Research from organizations such as the Mayo Clinic, the Cleveland Clinic, and the American Heart Association consistently reinforces another principle that becomes increasingly important with age. Health is interconnected. Better sleep supports healthier blood pressure. Regular movement supports healthier circulation. Good nutrition helps preserve muscle mass. Managing diabetes protects nerves and blood vessels. Treating sleep apnea may improve cardiovascular health. Addressing one issue often improves several others at the same time. That's one reason I encourage patients not to focus exclusively on symptoms. Instead, focus on building habits that support your entire body. John, the retired electrician I mentioned earlier, made several small changes after we reviewed his situation together. He didn't suddenly begin running marathons. He didn't spend hours in a fitness center. Instead, he set a timer that reminded him to move every 45 minutes. He added simple calf raises while brushing his teeth. He walked around the block after dinner with his wife most evenings. He worked with a physical therapist to strengthen his legs safely. 6 months later, he smiled during his follow-up appointment. "Doctor," he said, "my legs don't feel 20 years younger." Then he laughed, "But they don't feel 80 anymore either." That answer made me smile because it reflected realistic expectations. Healthy aging isn't about turning back the clock. It's about helping your body function as well as it possibly can today. Many of my healthiest patients still have arthritis. Some have diabetes. Others take medications for heart disease or high blood pressure. What they share isn't perfect health. They share consistent habits. They stay curious. They remain engaged in their own care. They ask questions, and they understand that small improvements accumulate over time. Before we finish, I'd like you to remember one final thought. Your legs carry you through life. They've taken you to work for decades. They've walked beside friends and family. They've carried children, grandchildren, groceries, luggage, and countless memories. Asking why they suddenly feel heavier isn't complaining. It's paying attention to a part of your body that has faithfully supported you for many years. Sometimes the answer is simple. Sometimes it requires further evaluation. Either way, listening to your body is one of the smartest things you can do. If today's discussion helped you better understand why heavy legs don't always mean something is wrong with your heart, I'd be honored to have you subscribe. My goal is to help make medical research understandable so you can make informed decisions with your own healthcare provider. Before you go, I'd like to ask you one question. When do your legs feel the heaviest? First thing in the morning? After sitting for a long time? After standing? Or toward the end of the day? Share your experience in the comments. You may discover that many others have noticed the same pattern, and your story could encourage someone else to seek the answers they've been putting off. Thank you for spending this time with me. Take good care of yourself, stay curious about your health, and remember that small choices made consistently often have the greatest impact on how well you move through the years ahead.